Okay, so dry eyes. Probably one of my most passionate topics I like to discuss with patients because it causes a lot of visual issues and there's a lot of different things you can do to help take care of it and improve vision overall. Dry eye is a multifactorial disease of the ocular surface characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms, which include tear film instability, hyperosmolarity, ocular surface inflammation, damage, and neurosensory abnormalities that play etiological roles. What does all that mean? This means that whenever your eyes are dry, you can experience a lot of the following symptoms, which include watery eye, dry eye, irritated eye, itchy eye, burning eye, stinging eye. Eyelids feel like that they're stuck or matted together. Your vision changing inconsistently throughout the day. And if you feel like you have to blink a lot to make things clear up, that's you actually refreshing the tear film a lot more in order to get the vision more clear. Because light, as it enters the eyeball, it needs to pass through the tear film, which is the fluid that sits on the front of the eyeball in front of your cornea. It needs to be consistently clear and even in order for light to pass through evenly to reach the back of your eyes. But if there's gaps, holes, patches, irritated sections of the tear film, you're going to notice some visual changes and fluctuations, specifically at nighttime as well too. Let's say if you're driving at night, let's say even if you're driving throughout the day, or if you're trying to read something, or if you work on a computer, you're going to notice a lot of these symptoms and issues that come up. And there's a whole bunch of other symptoms that can cause dry eye as well too. But those are just some of the main ones. So those are the symptoms. Now, what are some of the risk factors or causes of dry eye? Imbalance of hormones. This can be sex steroids, androgen deficiencies, etc. Old age really is not a risk factor or a problem of dry eye. We see this in younger patients as well as older patients. So if you're younger or older, you can have dry eye about evenly the same. We see this in 20-year-olds just as bad as we do 80-year-olds sometimes. Autoimmune collagen vascular diseases. This can include conditions like Sjogren's, that's a big one that we see a lot of, lupus, rheumatoid arthritis, scleroderma, temporal arteritis, polymyositis, I can't even say this, polymyositis, and Raynaud's phenomenon. Even using antihistamines, over-the-counter anti-allergy drugs, postmenopausal estrogen treatment, refractive surgery of the cornea like RK, PRK, LASIK, things like that. Thyroid disease, hepatitis C, radiation treatment like chemo, for example, hematopoietic stem cell transplantation, vitamin A deficiency, medications that can interfere, such as your antidepressants, diuretics, beta blockers, etc., diabetes, lots of reading, okay, so like crossword, stitching, crochet, puzzle, toy model construction, anything like that where you're not blinking regularly. And probably one of the biggest ones that I hear a lot about is computer work. Many of us work on computers, digital devices, phones, tablets, whatever it may be. And that's one of the biggest issues we see a lot of times with dry eye is that when patients don't blink enough, or when we don't blink enough, or when I don't blink enough when I'm on the computer, that can cause the tear film to evaporate really quickly off the front of your eyes. So when it comes to dry eyes, I've been mentioning something called the tear film. Let's break that down with this little picture y'all are going to see in just a few moments. So when it comes to the tear film, there are primarily three layers we like to analyze whenever it comes to seeing if something is a problem or if it's causing someone to have visual fluctuations or dry eye symptoms. The lipid layer is located on the outermost portion of the tear film, and it stabilizes the entire tear film because it keeps things from evaporating. It's like an oil barrier that's on the outside, basically. The aqueous layer is right underneath that. It's the largest portion of your tear film, and it's responsible for supplying moisture to your eyes in order for them to feel comfortable and for you to be able to see well. And on the backside is the mucus layer. This innermost layer consists of proteins called mucins that coat the eye and allow the aqueous layer to stick to the otherwise water repellent cornea. Because yeah, the cornea is water repellent. So with the tear film in mind, we like to identify and discover and uncover dryness when it bothers patients by two different types of dry eye. We're going to call this aqueous tear deficient and evaporative dry eye. So the first kind, aqueous tear deficient dry eye. What is that? This is what happens whenever the lacrimal glands produce water from the lacrimal glands located right above the eyebrow at a level that is considered too low, making it impossible for the surface of the eye to remain fully and sufficiently hydrated. So this can happen sometimes when there's inflammation, when the nerve endings when the nerve endings are not sending a good enough signal to the lacrimal gland, or there's an autoimmune condition at play, things like that. Next, we have evaporative dry eye, which usually happens when the meibomian glands, extremely important oil glands in the eyelids, become inflamed or blocked. These glands are found in the eyelids and are responsible for the production of the oily portion or the lipid part of the tear film we talked about a few moments ago. This oil keeps the tears stable, slowing down evaporation. And did you know that 86% of dry eye patients, this is information that's been uncovered in the past several years, but 86% of dry eye patients have signs of meibomian gland dysfunction, MGD. This means that the oil glands, the meibomian glands located in your eyelids, are not functioning properly, not giving you your full oil layer, and allowing things to evaporate too quickly off the front surface of your eyes, meaning that they're too dry and they can't retain the moisture that's needed to keep your tear film stabilized. But how do we treat dry eyes? That's where we're going with all this. So you got the symptoms, you got the causes. How do we treat it? If there's any inflammation, we like to identify that first. So if there's any inflamed redness, irritation, stuff that's causing some visual fluctuations to where it's eating up and chewing up the tear film and the corneas, we like to treat the inflammation first, whether that's with steroid eye drops, antibiotics, some prescription dry eye drops, like you may have heard of the names of Restasis or Xiidra, Avenova, especially, it's like a spray that you would spray onto the eyelids if there's any inflammation like blepharitis that's kind of dropping down into the eyes. Pure and Clean, it's another type of spray as well too. And if it's evaporative, we like to look at it in a different light, whether it's something in the spectrum of artificial tears, whether it's in a heated eye shield or like heated eye compress, punctal plugs, etc. There's different forms like that, and we're actually going to put a link right below this video here in a few moments that talks about one way that's really effective that we're going to go deeper into in just a few moments, which involves heat thermal pulsation to really open up those meibomian glands. And did you know that there is a nasal spray available to help treat dry eyes? More stuff like that is coming in the near future. But when it comes to treatment, there is a couple of instruments out there, whether it's called LipiFlow, iLux Squared, IPL, things that involve some level of heat and thermal pulsation to really open up the meibomian glands. Because what happens, we're going to show you a picture of this in just a few moments, is whenever the meibomian glands get clogged and blocked and unhealthy, that prevents the oily tear film from sticking around, which means it evaporates too quickly. Your healthy meibomian gland should look like, at least to us as the eye care professionals, that oil is being produced to the consistency of olive oil. It should look like olive oil. But if they get a little bit cloudy and hardened and clogged, it can look like candle wax, and it can even get worse and get significantly clogged to where we call that inspissated meibum. Meibum is the oil inside of your meibomian glands that whenever that gets clogged, it causes so many visual problems. And things that can open up and heat that hardened candle wax oil, it's like watching candle wax melt after a couple of hours. There's different instruments and procedures and technologies that really help melt that meibum to really get it producing on the front surface of your eyes to clear and stabilize that vision a lot more. And it works very effectively. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to learn more about your eyes. I'm Dr. Bryce Heffington, and we'll see you next time. So we have the MD Elite iPro X IPL device and the MD Elite Infinity Pro low-level light therapy device. What are these two devices? So let's talk about the iPro X first. It is an IPL device that is designed to superheat the skin, regenerate collagen, eliminate dryness and inflammation with light-based therapy. It's non-invasive. It feels wonderful because historically, IPL devices typically hurt. It's like someone snapping a rubber band on your face and repeatedly doing that. The beauty of this device, the iPro X, is that it not only combines intense pulse light, IPL, but also with radio frequency, RF, to help regenerate skin collagen development and to be able to diminish and significantly reduce any and all pain during the procedure to where most people don't even hardly feel anything other than just a little poke, basically, at most. That's worst case scenario. Now, what's the second device? the low-level light therapy device called the Infinity Pro. This is a multi-panel device that has several different color options, including infrared, in order to be able to help get light energy down inside the skin, help regenerate collagen, remove inflammation, clean up bacterial infections, you name it. It's a pretty impressive device that can help a lot of folks with a lot of symptoms that they're having. And if you've ever heard of red light therapy, this is a significantly upgraded version of that. The Infinity Pro is different from other devices because you have the option of being able to combine multiple colors. So for example, if you ever have like a red lamp, a blue lamp, a green lamp, a yellow lamp, whatever the color is that you want, you can actually combine the red and the blue lamp to get a pink light out of it, which is impressive because you get the effect of red light, which is inflammation removal, blue light, which is antibacterial cleanup. You combine those two, you get the exact same effect, which is impressive. Primarily, we are looking at dry eye evaluation, but dry eye has historically been not talked about very well. So it takes a very good discussion between the doctor and the patient in order to figure out if you're going to be a candidate for these devices and these procedures, because it helps to be able to have that conversation and know where your dry eyes are coming from and what you need to be able to be doing about it in order to get rid of that inflammation. Because that's the key, inflammation removal. If you look at most diseases, they're mostly inflammatory driven, and dry eyes is no different. It's an inflammatory multifactorial condition that we need to be able to use these devices to help remove inflammation. And for some treatment sessions, we may even do some gland expression, which can really help change the game on a lot of things. By gently tugging on the lids, getting all the juiced up oil out of the lids in order to jumpstart your oil gland production. It's an impressive feat. This is called meibomian gland expression. In today's video, we're going to be demonstrating two very important instruments in what we do for dry eye care. The first instrument is called the BlephX, and the second instrument is called the iLux 2. I'm Dr. Bryce Heffington, and we're going to be performing these procedures on Heather Heffington, also known as my mom. So let's begin. First thing we're going to do is we're going to get these little instrument devices out and prepared. But first things first, we're going to need to make sure that Heather's got her glasses off, tissue for when we put the numbing drops in, because we like to numb the patients up for just comfort measures at this point. So it's just a little Preparacaine 0.5%. And all I need you to do is lean your head back for me, look up to the ceiling as high as you can go. Just keep looking up right there for me. Good. You can kind of blink a couple of times and catch the little drops that run down your cheeks. While she's doing that, we're going to prepare the BlephX tips. So how we prepare the BlephX tips is that we get these two little devices out. They kind of look like Q-tips, and we soak them in this little disinfectant foam, or antibiotic foam in this case. And we're just going to kind of scrub the outside of the eyelids, removing the biofilm, as well as removing the hardened oil gland capped over portions of her meibomian glands. Get a couple little spritzes there. And just let those sit for about 20 or 30 seconds or so. Heather's got some chronically dry eyes, but also a little condition known as EBMD, epithelial basement membrane dystrophy. This is kind of what happens when your corneal tissue regenerates too quickly, and there's holes, gaps, patches, and the eyes really don't feel that good, do they? How would you describe your eyes, Heather?
Burning, kind of just bruised, almost feeling dry and tired.
Yeah. Pretty common responses a lot of times for these patients, but this can really help you if you have dry eyes or anything affiliated to EBMD or watery eyes, gritty eyes, itchy eyes, stinging eyes, burning, light sensitive, watery, anything like that. So I'm going to step past you here. And we're going to get ready to do the first eye. So we always start with the right eye usually. We put the little Q-tip looking device into the little BlephX, little instrument right here. And we're just going to start with the right lower eyelid. Ask you to step over here for me, Mark. Thank you. Ready for this, Heather?
Yeah.
Okay. Lean your head back in the chair. Look up to the ceiling as high as you can go. And what's going to happen is I'm just going to be pressing this little button here. You just keep looking up for me. Doing great, Mom. Just kind of scribble along the bottom eyelid here. See how we kind of just go back and forth as if we're kind of scribbling on a piece of paper? Great. That's all there is to it. Check out all the eyeliner we were able to just briefly get off or remove. Ready for eyelid number 2? All right, look down toward your toes for me. Keep looking down. So it just kind of skirts along the outside of the eyelids, the eyelid margin, removing some of the biofilm. Like going through a car wash for your eyes in a way. Check that out. All the makeup and eyeliner that we were able to
taken my
remove.
makeup off too.
Even
more.
Even more.
That's about $400 a Maybelline.
So that's the first eye that's been completed.
I love that feeling. That one feels so much better already. It's real like clean.
It's like a teeth cleaning in a lot of ways.
Like I've got my one tooth clean. This one's clean, and this one feels like all gunky.
Yeah. This would be a good demonstration for people if we just do one eye, let them sit for a minute, and then wait to do the other eye.
This one feels fresh.
Good. We like refreshed eyes. Ready for eye number 2?
Ready.
Okay. Once again, lean your head back. Look up as high as you can go for me. You just keep looking up. Removing all the caked up hardened oil and any crustiness, the biofilm, dead skin cells, anything around the eyelids that's causing any eye irritation, dryness issues. The nice thing about this instrument is that it goes both clockwise and counterclockwise. And when I press this little button, it just tells it which direction to go, clockwise or counterclockwise. Now we'll do the last eyelid. So just look down toward your toes for me. You just keep looking down as best you can. Doing great, Mom. Another round of makeup, eyeliner removed. Look at all that we just took off of you. But that is how we do the BlephX. Takes about 2 to 3 minutes to perform, and the patients often feel like that their eyes just got a teeth cleaning in a lot of ways.
Feels good.
We like feeling good.
What was that one thing called?
The biofilm?
Yeah, what is that?
It's just like a layer of bacteria, dead skin cells that are sitting on your eyelids, basically. Probably does. It's like removing plaque in your teeth, basically, in a lot of ways.
Somebody described it, it's like putting a fresh windshield wiper on your car.
That would be yeah, that makes sense in many good ways. So now we're going to move to instrument number 2. This is known as the iLux 2. Was FDA approved, passed, and released to the market in this past spring. And it's been a huge blessing and an awesome benefit to help take care of a lot of dry eye patients and myself as well too. I've had both instruments done on me as well, and it's made a very big game-changing difference as far as my dry eyes go. Heather was actually one of the first patients that received both treatments, except we're doing it in a little bit of a different order. She had the oil device previously and then the lid scrubber. Now we're doing the lid scrubber and then the oil device in the proper sequence that we found to be most effective. So how this works, there's a little digital pop-up screen display that we're going to be able to look and see how we're lined up with her eyelids. But this little device here is going to kind of grab and heat up the eyelids to about 38 to 42 degrees Celsius, also known as 100 to 108 degrees Fahrenheit. You ready?
Ready.
Okay. Lean your head back for us. Look up to the ceiling as high as you can go. And we just kind of slip this into the lower eyelid right there. And kind of line that up. Grab the lid, and you can go ahead and close your eyes for me, Mom. So if you want to watch on the little display, as she relaxes and her eyes have a little bit of a spa treatment, this device is heating up, that we're currently at 36 degrees Celsius. Do you feel it warming up, Heather? Okay, Very good. And once it hits about 38 degrees Celsius or 100 degrees Fahrenheit, there's a little timer that starts. And we usually like to let this go for about 40 to 50 seconds to really melt all that juicy, hardened oil. It's like a candle wax consistency inside your eyelids. You're about 20 seconds in. You're doing great. And about 30 seconds in. And we're now at 40 seconds. So we're going to push all that nice oil to the surface with this little mini massager sequence. One more little push. Good. That's what it takes to do one eyelid. We just do that 3 more times and that completes the entire procedure. How do you feel so far?
Good.
Good.
Nice and relaxing.
We like nice and
It's
relaxing.
warm.
We like warm, nice, relaxing, melting all that hardened oil to get it to the surface. Because we did this several months ago, but given your condition of EBMD, we're going to need to do this maybe a little bit more frequently for you, especially as we go into the winter months, furnaces firing up, things like that. Ready for number 2?
Ready.
Lean your head back, look down toward your toes this time. So we just invert the instrument, flip it upside down to catch that upper lid. Grab the upper lid, go ahead and close your eyes for us. And then we just let it do the same thing again, hold it in place. And 30 seconds in. And you're now 40 seconds in, so we're going to kind of push all that nice melted oil to the surface. Great.
Feels very wet.
Good. We like very wet. Once we get that oil back, it should start filling in some of those areas that your cornea is a little irritated on.
Did you see some stuff coming out?
No, it just looked like regular oil. We're just promoting more of the glands to open up. Because you had a couple of them that we're doing, but we need more doing them.
This one feels so much more wet.
Mm-hmm. That was the more irritated eye initially too when we were looking. Ready to keep going?
Ready?
Okay. Lean your head back, look up, tilt your head a little bit this way for us. Look up as high as you can go. Grab the lid, go ahead and close your eyes for us. Let's do the same thing, heating up the left lower eyelid, meibomian glands. Does that feel okay for you?
Mm-hmm.
There's been some patients that have had this done that have had some hardened oil that's only come out like toothpaste, not like warm olive oil. So the more olive oil we can get, the better this is going to be. But if it comes out like toothpaste too, it's still going to help you feel really good. Mm-hmm. But we haven't seen toothpaste hit on you at all. And that's 40 seconds in, so now we are just going to push all that nice golden oil to the surface and really get things producing. There's a lot of good oil glands pushing to the surface right there. Get a picture of that. I'll get rid of that. Was that one a little forceful?
No.
It wasn't? Okay. There was a ton of good oil coming to the surface
Really?
on that one. Yes. Good olive oil too.
Nice. Will that promote more?
Mm-hmm. It'll promote a lot more. It was like, I can't think of the word for it right now.
Was it like loose?
Loose olive oil.
Was it like that when I had it done before, or this time better?
This time better, I'd say, because you're already kind of opened up and loosened up for it. So we'll go ahead and snag the last eyelid. You got it. Just look down for me toward your toes this time. You okay?
Mm-hmm.
Just keep looking down as best you can. Good. Good. Just like that. Now just keep your eyes closed. And your timer started. And 20 seconds in. $30 seconds. And that's 40 seconds now. So lastly, we'll just kind of push all that nice upper eyelid oil to the surface. Very good. If you like this video and this demonstration today, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to stay up to date on the latest content we release. I'm Dr. Bryce Heffington, and we'll see you next time.
Dry eye is more prevalent than ever before, and the medical community has been evolving to address the needs of patients. In this episode of OcuTalk, Dr. Bryce Heffington explains what dry eye is, symptoms to look out for, different treatment options available, and new innovations being explored. Dr. Heffington?
I want to talk to you.
Not now, later.
No, now.
My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Hello everyone, and thank you for joining us for a brand new episode of OcuTalk. My name's Nick, and today we have a very special guest joining us. Everyone, please welcome Dr. Bryce Heffington. Dr. Heffington, thank you so much for joining us today.
Thanks for having me, Nick. It's great to be with you and talk a little bit about some dry eye stuff and other eye care things. So looking forward to it.
Well, absolutely. Dr. Heffington, thank you again for joining us. We know you're very busy, have a very busy schedule, so we appreciate it. So Dr. Heffington, before we get going today, do you mind maybe letting us know a little bit about your background and your specialty?
So go back a long time ago when I was a kid. Probably the thing that got me inspired and encouraged and passionate about eye care was my optometrist. Whenever I was probably about 5, 6 years old, we have a small family business in Springfield, Missouri. We've got 2 stores. My grandpa got it started in the mid 70s when he used to work with American Optical. Eventually he got a hold of all the equipment. Long story short, we're still here 48 years later, 3 generations in now that we have our own manufacturing laboratory. So basically my eye doctor as a kid kind of what got me inspired to consider the career of optometer. It wasn't my first career choice though. First one was definitely meteorology. I wanted to be a weatherman. I thought that was awesome for what they did on TV. The science, just the elements, the high pressure systems, low pressure systems, all that, but just the relational aspect that my optometrist as a kid, Dr. Jim Sweeney, had with patients, and just getting to see them on a regular basis, kind of educate them, teach them, and just kind of share with them what got him excited about how to take care of their eyes. So that's kind of what got me excited too. Fast forward many years later, through undergrad, through everything, went down to Memphis, Southern College of Optometry, Memphis, Tennessee, started in August of 14, went to 4 years there. I actually met my wife through our church down there, High Point Church. And basically, long story short, she decided to come with me on this crazy ride back up to this family business because that was kind of the plan of me wanting to come back and work and alongside my other family members. So it's been a huge blessing. That's kind of like that 30-second, minute-long elevator speech for where I've come from and just kind of the ways that I've gotten involved in eye care. And I've been doing this for, going on 5 years now, I think. So it's gone really fast.
Well, that is an amazing story, Dr. Havington. Thank you for sharing. And by the way, you would have been a great meteorologist anyway. So
Well, thank you. Maybe to become a side career one day. Who knows?
that well, you never know. Well, again, thank you for sharing with us with that. That's amazing. And so for our discussion today, Dr. Havington, we were kind of hoping you could discuss with us a little bit about dry eye disease and the current trends in dry eye. So to start, can you explain what dry eye is to some of our viewers who may not know?
There's a lot of different definitions and variations out there, Nick, of what dry eye involves. Is it autoimmune related? Is it evaporative? But basically, it comes down to two schools of thought, one of which is called aqueous deficient dry eye. I see this quite a bit when it comes to patients that have certain autoimmune conditions like lupus, Sjogren's, anything like that, that kind of is a recurrent inflammatory condition of the body that kind of goes after the lacrimal glands, that decreases the amount of watery tear film that goes to the front of the eyes, which causes someone to be aqueous deficient. And the other kind, which is probably a lot more common, and apparently 86% of patients with dry eye have this condition called evaporative dry eye. And specifically, what I've been studying a lot over the past several years have included the meibomian glands, these little tiny oil glands that we all have in our eyelids, that when you blink, it should be, the way I like to describe it to patients is it's like squeezing warm popcorn butter oil over the front surface of the eyes, the cornea, the tear film, give you clear vision because it's actually part of your glasses and contact lens prescription. But sometimes if we do too much reading, computer work, books, phone, crochet, crossword, driving, I mean, really anything for that matter, where you're not blinking enough, those glands get plugged up and it becomes like a stick of hardened butter in the refrigerator. And that's kind of what comes from not having enough oil on your tear film, because you've got oil, water, and mucus, and all those layers kind of need to be in harmonious synchronization with one another. And if you have a deficiency in the outer layer, the oil layer, it's going to just allow water to run down your cheeks or evaporate too quickly in front of you and can lead to a lot of issues. But mostly it's just the evaporative, like oil deficient, and aqueous deficient, which is like water deficient dry eye, from what I typically see.
Well, gotcha. So excellent information. So now we know a couple of different types of dry eye. And so how are they typically distinguished in your office?
Usually we go through an extensive case history, like ask the patient a lot of questions. I've got dry eye as well too, so I'm a patient of this as well, to just kind of talk about what's giving me issues. Because a lot of people think that, is this just an age thing? Like, is it just because I'm old or something? No, we're seeing this of younger patients, middle-aged patients, and older patients, just for a variety of reasons. So we go through an extensive health history just to make sure if there's any autoimmune or chronic inflammatory recurrent concerns that could inflame those the lacrimal glands to decrease the water supply. That's one thing we'll kind of use to eliminate, especially if there's any family history of anything like that. Another way we'll distinguish and differentiate the evaporative kind has to do with meibography, infrared imaging of the meibomian glands we do now at in our exams, as well as for patient care, but also triaging to see if there is any reduced T-BUT, tear breakup tests. Like we use the sodium fluorescein. It's like this yellow staining dye that just tells us how quickly the tear film evaporates. It's like kind of pouring water onto a hot concrete surface just to see if it dissipates really quickly. So those are just a few tests I use, and some of the docs use different tests as well too. But for me, just kind of where I've gotten a little bit of my passion in just seeing the T-BUTs, seeing the infrared meibography changes issues, and seeing if there's a prescription change that's a little bit undescribable. Do they work from home? Ask about lifestyle questions. Do they work on the computer a lot? Do they use their phone a lot? Have they taken up new hobbies like stitching? Because there's a lot of people over the past several years who have taken up new hobbies that it's just more than medical questions. Like, what do you do in your spare time for social enjoyment purposes? And then some people say, well, I've really gotten involved in X, Y, or Z, and I use a lot of that on my eyes every single day, 12, 14, 16 hours, whatever it is. So just really kind of listening and asking the questions, but get some scientific data to back up what we may be uncovering and listening to patients about.
Well, fantastic. I'm loving all the imagery too, the pouring water on the concrete, putting butter in the fridge. I'm loving the imagery today. So we appreciate that, Dr. Havington. And so before the patients get into your office, what are the type of symptoms that we should probably be on the lookout for? Probably outside of our eyes kind of feeling dry, that we may have like dry eye syndrome or something like that.
So yeah, symptoms that I ask patients a lot of times are, first of all, are you aware, do you think you have some level of dry eye? Sometimes it's yes, sometimes it's no. Other things I'll ask are, do your eyes ever feel like that they're dry, burning, itching, stinging, scratchy, feel like they're light sensitive, feel like you have to kind of blink a lot to get things cleared up? Because a lot of people don't really put that together of if you're blinking, it's people like cars and they like food. So the way I like to describe it is it's like a windshield wiper that's supposed to be spewing olive oil all over your windshield. And if you have to blink a lot and get the windshield wipers going again, then you maybe not having enough olive oil on the corneal surface in the tear film. So those are just a couple of the symptoms. Allergies have a lot of these similarities too. So a lot of people think that, well, I've just got allergies, well, I've just got dry eyes, well, I've got both. And it's really interesting to try to distinguish between the two because they sound so identical in a lot of ways. But there's some distinguishing characteristics for allergies, like the itchiness in particular, yet you can have that with dry eyes as well too. But also to recognize the time of the year. Are people doing a lot of spring cleaning? Are they doing a lot of mowing? Are they doing a lot of raking of leaves in the fall? Did their furnace just kick on and it's a drier time of the year during winter, basically? So just those are some things that not only do you ask about symptoms, but just consider the time of the year, consider their hobbies, consider their lifestyle and what they do, just to see, do they work in construction? Are they in a sterile office all day? Are they doing surgeries? Whatever it looks like.
Well, that's actually a very good answer because I don't think a lot about environmental things too. So that's actually a really good idea to always remember what you're doing. So fantastic information, Dr. Heffington. And I know you talked about it a little bit before at the beginning about your process. Once the patients come in, you ask them all these questions, and then we're doing like fluorescein dyeing and tear breakup time. So what's that office visit mainly like once they come in and once you do all of that?
So once they come in and we talk about, do you have dry eyes or not? Do we do the testing for it? Do you have it? And let's open up the discussion for that. So there's a lot of different things a lot of people have heard about, whether it's prescription dry eye drops, whether it's artificial tears or heated eye shields or specific dry eye procedures that we do here in office. And we talk about all those options just to see if something kind of piques the patient's interest a lot more. Because a lot of patients with dry eyes have done the Restasis, the Xiidra, the prescription dry eye drops for years, and some of them feel like it works well for them, and some of them feel like it hasn't gotten anywhere for them. But some stuff we'll talk about and that we've done years ago before we started doing what we were doing recently is to open up the conversation about, yes, we'll talk about artificial tears. Yes, we'll talk about heated eye shields. It's kind of where we started from when we started doing dry eye stuff leading into what was the pandemic years, basically. Now for a little over a year now, we've done more of the BlephX and iLux 2 options, and we've actually done quite a bit of those here. That's been some newer stuff for meibomian gland expression and heating, and I made some videos on YouTube that I just kind of describe this to patients. I've got like a huge TV in the exam room with a picture of one of the earlier patients that I've done, and I was like, hey, can I use this as just like demonstration for people so they can kind of understand what these glands are? Because now more recently, since I put this up a few months ago, all of them look at that picture and go, what is that? And is that me? Because they want to know, is something wrong with me? Is there something going on? And who is that me, basically? But it just paints a really good picture to open up the discussion to say, here's what we do. Here's an option for you. You can consider this just something a little bit different. And it kind of helps not have to use the eye drops, not have to use the heated eye shield or anything like that for you for potentially several years, potentially 1 year, potentially 6 months. It just kind of depends on how you respond to it. So really just opening up the conversation to say there are more options than just artificial tears, prescription dry eye drops, and heated eye shield stuff, because we've done all that. But this is kind of the newest one that's taken quite a interest in a lot of patients, as well as myself, because I've had it done twice, and it's been a significant help for me since I do a lot of charting, a lot of video editing, a lot of stuff on the computer and the phone for sure.
Absolutely. And Dr. Heffington, you actually talked about it a little bit there. And maybe when I ask this question, maybe you'll say the same thing, but I wanted to ask anyway. So when a patient comes in and they're looking at all the stuff that you're showing them and the different things that you're going through with them, is there a difference between, let's say, if a patient comes in who has like mild to moderate dry eye and a patient who comes in and has like moderate to severe dry eye? Are you doing those like in-office procedures with like your, like you said, BlephX and other treatments? What's like the difference between a patient who comes in with mild to moderate and someone who has moderate to severe dry eye? What do those typically look like?
That's a great question, Nick. We get that a lot from patients. Like, what bucket do I fall in? Am I mild? Am I moderate? Am I severe? Like, what are we doing with this? So first thing I like to identify is there any levels of inflammation going on with the cornea, the conjunctiva, the tissue underneath the eyelids, to see if there's any bumps, lumps, irritation, pinpoint dots of irritation, keratoconjunctiva sicca, anything like that. And if there is, then I usually start the patients on some level of mild to moderately strength steroid eye drops just to squash that inflammation. Because if there's inflammation, you can't really get much done with anything, just because it's like oftentimes when people are like, what does it mean inflammation, lumps and bumps? And I usually say like, okay, let's just say you have diabetes or you have type 1 or type 2 diabetes and your blood sugars or A1C are all over the map. This is what happens in inflammatory dry eye, to where your prescription can be off. Some days could be better than others. You could have certain things that may set you off, but basically we got to squash this inflammation over the course of several weeks or months, depending on how bad and how severe it is, before we look into any of these other procedures. Now, if someone comes in and is non-inflamed in a mild, moderate, or severe category, because it's all symptom subjective based, then we can talk about those other therapeutic and treatment options. But if they're inflamed, red eyes, really ticked off, we usually throw some steroid drops on to calm them down pretty quickly, assuming that's all it is. If it's something viral or bacterial, then obviously we'll throw antibiotics on. But if it's viral, we just kind of watch it and make sure it doesn't go into anything like herpes or anything shingles related or anything like that. So a little bit more of a cautious approach when there's those level of pathogens and conditions that can influence all this. So just squash inflammation. Then once the inflammation is taken care of, we open the door to see if they actually still want any of those other options, because some people just need the steroid drops, and that's great. That helps take care of a lot of the symptoms they're having because that inflammation's gone. But even though they have a little bit of dryness, it may not be as bad as it once was, and it may work out better for them. But at least they've gained the knowledge, experience, and kind of walked through to what to know, what to expect, and how it can be better taken care of. And there's some longer term options to keep this inflammation at bay.
Well, absolutely, and fantastic information, Dr. Havington. And so now, once the patient has been in the office, you've diagnosed them, we've done in-office procedures, what's the protocol now when you go, okay, I need you to go home and we take this, depending on, of course, every patient's different, right? So we have the, like I said, mild to moderate severe. What is like the long-term recommendations that you tell your patients when they go home with this stuff? Because it's all about compliance, right? So what do you typically recommend to your patients?
Usually if they're inflamed and we start the steroid eye drops, I'll say, let's start these drops X amount of times a day, depending on how severe it is. If it's severe, obviously you're going to be doing a lot more, but let's bring you back in like 2 to 4 weeks and see how you're doing there and modify as we go until we get you off of the drops, basically. Then once you're out of inflamed category, then we can move into therapeutic category. And this can include anything like antibiotics, like Doxy. This can include the dry eye procedures we talked about, but specifically what I've been working on the dry eye, we call it our dry eye clinic here. But what I've been doing there with some of the procedures that we do for the BlephX, Ilux squared, and all that is we'll do the procedure on one day, whether it's the same day the patient comes in, if they're not inflamed, or if we need to bring them back because they're going to go on vacation soon or travel for work or whatever it looks like. We'll do the procedure, and then we usually like to see them back at 1 week and 1 month for tear film checks and follow-ups, because we like to see if that T-but or the meibomian glands are starting to open up a little bit more. And the 1 week, we don't really gain too much new information. The patients may say, I don't notice any difference, or I may feel like a fraction better. And that usually holds true. But mostly it's just like a pat on the back of like, you're doing everything right. We're just kind of making sure you're moving in the right linear progression. Because a lot of times I'll tell patients, it's nice if we could get something that could go exponential for you. But most of the time it's a linear path of how you get your tear film back. So we bring them back at 1 week, and then I'll say, let's check back in a couple of weeks at 1 month, and we'll already have that appointment scheduled just to see what things look like at 1 month. And at the 1 month mark, it's interesting, Nick, because a lot of times the glasses and contact lens prescription can change. I've seen it change about 50% of the time, because once that tear film thickens back up and actually gets a little bit healthier, it changes the density and the liquid amount that light actually has to go through. It has to go through more oil, more water, and more mucus. And it can change people's prescription a lot of time, which over the past year, having done this several hundreds of times, I've seen it change about 50% of the time. So I let patients know, look, if you're considering updating the glasses or contact lenses, we're going to reevaluate these numbers at the 1 month mark, because that's when we see things kind of stabilize a little bit more. Technically, it can take up to 5 to 8 weeks, but from what I've been seeing on a lot of patients, at that 1 month mark, keeps the patients compliant, gives them a motivation to say, okay, yeah, I probably want to update my glasses and contact lenses, but I don't want to do it prematurely because the numbers could change. So that at least kind of gives them some specific goals and milestones to meet in order to keep them compliant, as well as for us to make sure they're moving in the right direction. And we're still modifying it as we go, but those are just some basic things. And for at-home stuff, if someone wants to use the heated eye shield, if they can't afford the procedures because medical and vision insurances don't do a lot for it right now, but some people have flex spending plans. It kind of varies a lot of times. But for lubrication drops, for heated eye shields, for prescription dry eye drops or anything like that, We'll give them a set regimen, like for the heated eye shield. If they need to use it once or twice a day, great. Do it in the morning or do it in the evening. Don't exceed that. Artificial tears, a lot of times there's no limit to them. You can, I sometimes tell patients you can do it 100 times a day, and there's not really going to be a problem with it because there's no active substances in it. And for the dry eye prescription drops, it's a little bit different too, for just that once or twice a day dosing, just to see if they want to do that. But when you talk about the prescription dry eye drops and the procedure, the prescription dry eye drops can ring kind of this is a little bit more expensive bell. I've tried this before, hasn't really worked out for me. But some of the new dry eye procedures we're getting into and starting to kind of learn a little bit more about has opened the door for patients. Yes, it may be a little expensive, but it does do something that you may have not had done before. It may give you some new possibilities, and it should help you feel a lot better and your tears to go back to normal too. So that's just kind of the at-home versus in-office. Or if you do in-office procedure, you're kind of under a guided structure. If you're at home, it's like, think about it like brushing your teeth. Here's what we're going to do with this just to keep things at bay and keep things clean, basically. And we talk about eyelid scrubs like OcuSoft, sustained lid scrubs, anything like that patients will pick up at the grocery store or pharmacy or anything like that, just to kind of keep the crustiness at bay, keep the Demodex at bay, anything like that.
Well, fantastic information, Dr. Heffington. And I know you talked about it a little bit earlier too, and I know we've talked about it as well earlier, but it's hard to talk about preventative care sometimes. Sometimes things can become unavoidable. But do you recommend anything to kind of help prevent patients from getting dry eye? Is there something that you would recommend personally?
Probably the number one thing I'd recommend is make sure you get your eyes checked once a year. I mean, there's not really there are optometrists and ophthalmologists that will call themselves dry eye specialists, but really it just comes down to how much passion the doctor has about it. It comes to how much insight and kind of their niche of what they get involved with. So the best thing I'd recommend is just making sure the patients get their eyes checked once a year at their annual eye care visit. That's what the American Optometric Association recommends. That's what we usually recommend. And usually that can open the door of conversation where someone comes in to just get their eyes checked. And they say, what's going on with your eyes? Any new developments? Well, yeah, actually, I have noticed a lot more light sensitivity. So that kind of opens up the door of conversation, well, tell me a little bit more about that. Then it can kind of lead to other things. And yeah, some people can take care of their eyes by doing some over-the-counter regimen stuff with the heated eye shield, the artificial tears, all that stuff on their own if they want to. But it kind of helps to have that healthcare professional in your corner that can see things from the objective standpoint of okay, let's unpack that a little bit more. You say that you've been noticing some scratchiness. So what have you noticed recently? Has anything changed in your diet? Has anything changed environmentally? Have you tried new makeup, mascara, eyeliner products or anything like that? Let's unpack that a little bit more. Have you had any new health history events that have come down? Have you started any new medications? So really, that's the biggest thing, to kind of keep things at bay, but also to have someone in your corner that's advocating for you, especially in this day and age to where there's a lot of information floating around on the internet and everywhere else that patients can find it. But really to have a passionate healthcare professional that is deeply invested in wanting to add value to someone's life, that's probably the biggest thing I'd recommend for sure.
Well, fantastic. And one other question I wanted to ask you, Dr. Heffington, and I wanted to ask you, how has the dry eye landscape changed over the last few years? So, and I wanted to ask you just to get your perspective on that and see what you thought about that.
Extremely fascinating for sure, Nick, because ever since when I was in school, I mean, there was some new stuff coming out, and there were some instruments and technology and procedures that were coming out to help open the meibomian glands, because that's really kind of an interest that a lot of us have, to get those oil glands open to really make sure they're promoting and producing. But having been in this several years now, it's kind of amazing how much of it has changed. A lot of instruments have been discontinued, taken off the market because they weren't effective or too expensive. Now where things are kind of going, the iLux Square wasn't even readily available, and it just came out towards the first generation came out towards the tail end of my schooling, so it was kind of a new thing. LipiFlow has been out for a long time, and that's been around for a while, and a lot of patients know how expensive that is, but it's nice to have a competitor in the market as well too, to keep things sharp for everyone wanting to know a little bit more. We've been investigating some new things. It's getting there. It's kind of new, but it takes IPL, intense pulsated light, plus radio frequency to combine the two instruments that a lot of derm and a lot of cosmetic clinics have been doing, that really takes care of the inflammation down deep inside the lids and the meibomian oil glands. So instead of just getting to the surface, it goes down throughout the root of the whole thing and can technically get rid of spider web veins. These instruments are already out there, and some I would say more dermatology clinics are doing this, but it's something that eye care professionals are getting into a little bit more. And it does take a little bit more required compliance, such as the patients who need to come back every 2 weeks for 2 months, basically. So it's a pretty heavy time commitment that some people are like, well, I've got vacation, I got my kids traveling sports and different things that they're great ideas. And the landscape is changing so fast. Like it takes a lot for me to keep up with it even. And I love being able to learn about it too, because it keeps me sharp on my toes. And especially as information gets dispersed out there, patients are going to be asking us about it. And I like to be able to at least have a better understanding to help kind of disperse a little bit more directed education compared to just here's a shotgun of information to pick from, basically. So IPL and RF have been something kind of interesting. That's been kind of the new thing coming about in dry eye management. But just continuing to heat and express the meibomian glands is kind of a big thing that a lot of us are going after right now. But also being able to just contain and control the inflammation as well too. That's like the biggest thing to get started on before we do any other procedures like that too. We've looked into IPL, we've looked into all types of other stuff as well too, and they've been successful for helping taking care of patients. It's just finding the right match for what would work best for the patients that are coming in. And depending on the geography of your area, where you're practicing at, what the clientele, the patients are like, it kind of all factors into all of that to see what would best take care of them. Would heated eye shields work better for patients? We did that for a while and it was massively beneficial for a lot of people. $25, throw it in the microwave once or twice a day, great. But then once following up with these patients years later, they lost it or forgot to do it or got exhausted with going to the microwave every day. So we needed to change and adapt things. Say, okay, we need to do things a little bit better. Let's think of this like teeth cleaning and dentistry, basically. So you get your teeth cleaned, you do stuff at home, you come to the dentist, what, every 6 months, 3 months, 12 months, whatever it is to get your teeth cleaned. And that's kind of a model that we've tried to hammer home and educate patients on of like, think of this like that. I know this is something kind of new that we're doing, but this is what we want you to think of it as. So it's interesting how much it keeps changing. And I'm excited to see what new prescription drops are going to come on the market, especially for getting rid of Demodex over the next few years, because there's some new exciting developments coming into the market on that and in the FDA approval pipeline process. So very fascinating, crazy fast how it changes.
Thank you for that information, Dr. Heffington. And before we leave today, was there anything else that you'd like to let our audience know about?
Just talk to your local eye care professionals about what's going on with anything new regarding dry eyes, blepharitis, Demodex, or anything else that you may have a certain eye condition with, because information and knowledge is changing so fast in optometry and ophthalmology. It's amazing at how much new things are being implemented and new things are being investigated, researched, and analyzed, because it causes and challenges us to become sharpened and not to become too comfortable for just spending the numbers and here's your glasses or contact lens prescription, which is still important, but it's important to consider the other medical matters that are influencing patients' vision. So probably my number one thing to hit home to the audience watching this video or anywhere else you may be, talk to your local eye care professional. Get your eyes checked once a year. Ask the questions. And even if we don't have the answers, because we don't have all the answers, like no other optometrist or ophthalmologist has all the answers, but there are wiser people than where I'm at, even that I go to, that I talk to a lot of times, but hey, I've got this question. I need some more education on this. Like, teach me a little bit more about this. Share with me what I need to be asking and what I could be doing better, because we all can be learning, because we get better as we grow and learn. And in leadership of eye care professionals, we get better as we grow and learn too. So that would be just the main thing, is talk to your local eye care professional, do your own research, and be your own patient advocate. Don't be afraid to ask the questions. And if you feel like you're being talked down to or not appreciated for asking the questions, then you might need to go somewhere else and ask questions, because we're supposed to have the heart of teachers. We're supposed to be compassionate. We're supposed to want to and desire to add value to others' lives. And it's important that patients know that and can feel and understand that, because healthcare has been hit hard over the past several years. And to really have healthcare professionals in your corner is going to be the best piece of advocating advice that I'd love to impart to anyone that watches this.
Well, that is amazing, Dr. Heffington. Everyone, that was Dr. Bryce Heffington. Again, Dr. Heffington, thank you so much for joining us today.
Thanks, Nick. Thanks for having me on. Really appreciate it. In this video, we're going to be doing the BlephX and iLux 2 or iLux squared dry eye treatment. I'm Dr. Bryce Heffington, and I've got one of my colleagues, Dr. Aggie Bremer, with us today, who's got a little bit of dryness, been through a lot of school, a lot of computer, everything like that, that's kind of clogged up those oil glands. because we've got oil glands that every time that we blink, it should be like melted popcorn butter oil coming across the front of your eyes. But what happens over time is that when you do too much reading, crossword, stitching, computer work, anything like that, where you're not blinking as regularly, those glands can get plugged up like a stick of butter in the refrigerator to where it gets pretty uncomfortable and your eyes may water a lot. They may feel pretty tired, light sensitive, dry, burning, itching, stinging, gritty, anything like that. So what you're going to see in a few moments is one of the latest advancements in dry eye treatment to help open those glands up, but also clean them up at the same time. So Doc, lean your head back, look up to the ceiling as high as you can. We're just going to put a little proparacaine numbing eye drops in her eyes just to give a little comfort measure. But the numbing drops just kind of make your eyelids feel a little bit heavy. They don't change, alter, or modify the vision. And these particular numbing drops last about 45 minutes or so. So we've got this new material that we started using on patients recently. It's a combination of manuka honey and dead sea salt, which is actually very exfoliating, healthy for your eyes, very cleansing, relaxing, and gives you a very clean sensation for your eyelids. This is what we're going to soak the little Blefex tips in. Now, as you notice, it doesn't come out as much like foam as some other material that we've used previously, whether it's tea tree oil or a previous generation of this. So this is kind of some next generation stuff we're using. You just kind of leave the little tips to soak and all that fluid just kind of gets absorbed into the little tips there to get that manuka honey and dead sea salt infused into the Blefex tips. So Doc, I'm going to have you look up to the ceiling as high as you can for us. This little device spins clockwise and counterclockwise. It does just kind of tickle a little bit, but we noticed that over time, when you kind of push in with pressure just a little bit, it makes it a little bit more relaxing. Then we do a little counterclockwise rotation. Then look down toward your toes. And just a note about lash extensions. So a lot of times when we do these procedures, it can take off a little bit of eyeliner, makeup, mascara, anything like that. But in particular, the eyelash extensions can actually come off like a weed eater running through wet grass. So if you're considering a procedure like this, you'll definitely want to hold off on getting your eyelash extensions put in place or defer it until after you have the treatment done, just because it's going to take a lot of it off. Very good.
Okay. We're clean.
Starting with the right lower eyelid, look up to the ceiling as high as you can for me. And close your eyes and relax. Does that feel comfortable there?
Mm-hmm.
Very good. So as we're heating these meibomian oil glands up, the temperature is currently reading in Celsius on this device, which it gets up in between 38 to 42 degrees Celsius or 100 to 108 degrees Fahrenheit. That's the required temperature that you need in order to properly melt the hardened oil in those meibomian glands. And we usually do this for about 40 to 60 seconds, depending on the severity and cloggage of the meibomian glands. Gonna get rid of that.
What did it feel like?
It just a little bit of pressure. That's all that you feel.
Was it hot?
No, it was just like a little pressure right here, but no pain or discomfort.
Good, good.
Mm-hmm.
Excellent. Close your eyes and relax. Does that feel okay there?
Mm-hmm.
Okay. Like Dr. Bremer, I too have spent a lot of time on the computer and reading and video editing and everything else in between, that my glands have been clogged up pretty significantly as well. And this procedure has really helped open mine up on a more annual basis. My results tend to last about 11 or 12 months, but everyone's different. Very good. You better grab. There we go. And close your eyes. Does that feel okay there?
Mm-hmm.
Very good. And timer started. Still doing okay?
Mm-hmm.
Okay. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and learn more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time. Well, that was the highlight reels of what we've been able to do and help take care of folks with inflammation removal and some of the new exciting stuff going on. I'm Dr. Bryce Heffington. I've got Mark Heffington with us this evening as well. That'll be kind of just going over some questions and things y'all might want to learn a little bit more about some of this stuff. But first and foremost, we are men of God, and we would like to open this up with just a time of prayer to kick things off and honestly let the Holy Spirit speak for us, not our own wisdom.
Yes.
Heavenly Father, we thank you for this time. Thank you for this opportunity. Thank you for the technology you're giving us to help take care of people, help take care of vision, help take care of eyes, help take care of everything you've given us in the temples that you've allowed us to worship you in this time, God. Help us to walk by faith, not by sight, and just give us wisdom and discernment this evening, and let your joy and word be made known. In your name we pray. Amen.
Amen. Thank you. Hey, so I just want to say thank you all for coming and listening in on our little presentation. We are so excited about what we have to offer to help with dry eyes. There have been a lot of things over the years that have managed the symptoms but didn't really treat the problem. And we've got something today that's new technology to help with the problem. And talk to us, Doc, a little about inflammation and what that means.
So kind of like what you may have heard in the presentation, you look at most conditions, most diseases, most things out there that are giving a lot of people's issues. It can mostly be inflammatory driven. It can be something, whether it's an autoimmune condition or whether it's something around your eyes or whether it's something even like Sjogren's syndrome for where it's eyes, mouth, and joints, basically. There's just a lot of things that can plug up and jam up and honestly constipate those oil glands to just make your eyes not feel good, not see good, and mess with your prescription in all kinds of ways. So
it can. We've seen that. We've seen prescriptions. People will come in and their eyeglass prescription, they're like, I just can't. I don't see as well as I used to. Do I have cataracts? Do I have what's going on? And you look at their corneas, and they're just they look like the Sahara Desert. They're so dry and foggy that the light's not coming through. Mm-hmm. And so, getting oil production into the tears kind of are like this. There's like an oiliness on top. There's 97% salt water, and there's kind of a mucin on the bottom. And so, dry eyes are either two things. One, you either don't have enough water or the oiliness is gone. Mm-hmm. And here's the number. 86% of the population, it's an oiliness problem, and it's huge. And so these are technologies that we have now to kind of help out. Let's look at a couple of questions, then we'll come back and give you some more information.
Yeah. So our first question coming up here is, what is the age range for this procedure? So this is kind of interesting. I've been getting this question a lot when just talking with folks in the exam room, and even just people that aren't coming in for exams. They're looking for frames and just kind of hear us talking about things with other folks. So it's interesting because over the age of 18, obviously you don't need parental consent or anything to sign off on anything. But when you get down below the age of 18, like let's say teenage years, for example, then obviously you would need to get a parental figure or guardian involved to sign off on making sure that everyone's under the understanding that they can have these procedures. Because probably I'd say the lowest age we can go down to is early teens, I would say.
Yeah.
Safely and wisely.
Yeah. Everyone needs to kind of be evaluated. The doctors will do an examination, kind of check things, figure out what we need to do to help out with it. But the age thing on that, an interesting thing that happened when we were in our studies and getting educated on all this. We had our staff in there, and we looked around the room, and the person that was teaching us, she goes, "Who do you think has the worst meibomian glands in the room?" And everyone pointed at me. Okay, I was the oldest, gray-headed, old codger in there. We should have the worst glands, right? And so she says, and they're like, yeah. And I raised my hand. I go, "It's me." Okay. And then she goes, "Okay, let's shoot his glands." And when I say shoot, we took a picture of it with an infrared camera.
It's imaging.
We talked shooting today. That's not right. It's a picture. So we take a picture of it, and the glands on mine, they were bad. Okay. I mean, I kind of already knew they were going to be bad. And then she looked around the room and she goes, "Let me tell you who's going to have the worst glands in the room." And she picked out one of our youngest people who's 20, 21. And she goes, "His glands are going to be worse than yours." And I'm like, "No way." And she goes, "Yeah, let's shoot. Let's take a picture." I say shooting. "Let's take a picture of his glands." Okay. And so they take a picture of his glands and they're worse than mine. And I'm like, "How is that even possible?" And she said, because we used to think, well, okay, it's makeup, it's birthdays, it's blah, it's blah, it's blah. It ain't. It's too much not blinking right from the technology. Yeah. Computers, phones, iPads, tablets, you can go down the list. And when we don't blink right, and this 20-year-old, he was raised on technology. I didn't have it until I was, in my 40s. And so with his glands being that way, it's very important for us to not discount young people that say, "My eyes are dry," or "They don't feel good," or "My vision's blurry," because they could be worse than some of us gray-headed, smelly old men, right? What do you think, Doc? We're sitting right beside you. He is smelly and he is old. Okay, so
I'm getting wiser for sure. Yeah, but I've had this done 3 times now as a patient myself, and my colleagues do this on me, and the results, you wouldn't think that it would work, but my goodness, the results are incredible. How many times have you had this done, Mark?
I've had 3, and I can't wait to get my 4th. And here's one thing, one of the questions pop up: how often can you get this done? We're using a lot of energy, and we're using a lot of technology with that energy. And and there's different procedures we can do, so we can't lump this all into one thing. But usually 2 weeks or further out is kind of what we want to do. We don't want to do too much too soon, because you won't get the full effect out of it. One of the questions that pops up, it says, "Are your eyes open, or are they closed during the procedure?" So again, there's a lot of different procedures that we do. Some of them we do use little shields, like the tanning bed things. Other ones that we do, you can use protective shields. Other ones we just say, "Hey, have your eyes closed." And because there's different procedures, some of the procedures, the doctors say, "Hey, I need you to look up," and they'll work on the glands on the bottom. So if it's something that is uncomfortable, we definitely use protection on it. But sometimes we have to use protection on it because we're working around the glands and doing things with IPL. So,
the IPL historically we call them tanning goggles. I mean, this is what they kind of look like. For every IPL RF procedure, we'll use the little tanning goggles. For the low-level light therapy device, there are goggles available for those that are really sun sensitive, but latest evidence suggests that you don't need to use the goggles with it, because you're not going to damage or burn retinas or anything like that with it. It's actually been proven to help generate some stuff within folks that have macular degeneration. I mean, this is extremely early edge stuff with low level light therapy that we're still learning as well too. But it's kind of case by case stuff with that. This
is one of the technology pieces on this. Somebody asked a question about this. It says, is this FDA approved? And it is FDA approved. This is what they call a CPT. It's a current procedural technology device, which means it's gone through all the technicalities to get approved by the FDA. So you can do it without harming anybody. That's kind of what we're looking for on this. The technology on this, it goes back 30 years. So this isn't something that's brand new. But the reason we have waited until now, one of the things that we do with this is called IPL. It's intense pulsating light. And IPL, and this is another one of the questions, does this hurt? IPL is like somebody pulling a rubber band back and snapping. And so you want to fix somebody's dry eyes, take a rubber band and pop it around their eyes, right? But that's not what we're doing with this. The older technology was that way. Then they went to IPL2 and then IPL3. We've been waiting for IPL4, which is what we have now. And it uses IPL with radio frequency. And the discomfort on it is no more than somebody taking maybe like a warm flashlight and just touching it and touching it and touching it. And if we get to something that has a ton of inflammation, it may get to the point where it's almost like your feet coming across the carpeting and touching something metal.
Mhm.
But that's the extreme, and that doesn't happen through the whole procedures.
No.
And some people don't even have that experience at all. But we do know when you hit one of those spots, it's like, wow, that was really inflamed. Like, oh, I felt that a little bit, but it's not uncomfortable. And it is FDA approved. It doesn't burn your skin. It doesn't cause cancer. That's been proven. The other part of the question was, does this help with dry eyes due to allergies? Doc, what do you think about that?
Absolutely. There have been a lot of folks, especially that have been dealing with spring allergies, following them into the summer for whatever's blooming out there right now. And allergies in affiliation with dry eyes causes a lot of histamine, which is incredibly sticky, which is where you get your antihistamines from, which decreases stickiness, which can also dry your eyes out. But it helps with this amazingly with allergies. There have been some folks, especially under the low-level light therapy device, in conjunction with the IPL device, that didn't know this at the time. They were dealing with allergies and sinus problems and issues, and they've gone under the lamp for like 10, 15 minutes or something, and they come up out of the lamp, and then they say, let me ask you, does that help with sinus and allergy stuff? And I said, yeah, probably it could. I mean, it hasn't been proven because it's been newer to the eye game field, but in dermatology, it's been around since the 90s. So we're still learning about how the eyes and everything else goes with it. But it's been helping a lot of folks with sinus stuff, with allergy stuff, with infection stuff. It's been pretty incredible to see some of the results recently.
Really, really. We've seen some things come out of this that were unexpected, where people are like, oh my gosh, my sinuses feel better.
Yeah.
Can this help my sinuses? I'm like, it just did, or other things. One of the things that comes out of this, because this came from dermatology, it came from reducing inflammation, tightening skin, and growing collagen. That was its main function.
That's what it was.
And so then one of the side effects were, they noted that people's eyes are becoming more wet. And they're like, well, what's going on with this? And that's where the eye doctors got into it. Dermatology kind of said, I don't know, we're not eyes, we're skin. Let the eye doctors do it. So the eye doctors took it over at that point. And one of the side effects are these things right here and these things up here, because we're working around the eyes, it tightens skin. It's just a side effect to it. That's not our main focus, but it does do this, and it does work. The next question is, what's the cost of the procedure?
A few questions on pricing.
Pricing. Of course, that's you guys. I love you. It's like, what's the cost of this? I'm super excited about it. It's like, oh, well, here it comes. Okay, you ready? Get your pens out. It is expensive. Okay, this is like, we're going to take your house and your kids and your car. Okay, absolutely not. We don't want to take food off anybody's table. We're trying to make this as affordable as we can. And so the stuff that does these procedures, and there's multiple procedures that the doctors can do, but we like to kind of bundle them so that we can say, hey, you can get this and this and this done for a certain price, rather than, well, this costs so much and this costs so much and this costs so much, and you add it all up and you're like, oh, wow, I can't even afford this. So we like to do it in what we call the tier spa. And the tier spa is a program we've set up just for working around with the eyes. It's $59. That puts you into the tier spa. It's good for 90 days. Because we don't want this to be one of those things that just drags on and on and on. And, like every 2 weeks or every month, you got to come up with money to be able to afford this. We want it to work. And so we try to get it into a 90-day window or less. So we put the tier spa to 90 days, $59 puts you into it. The cost for any of the procedures the doctors want to do is $349. And so that's just kind of what it takes to make it work. If you added all the stuff up that the doctors can do, you're getting around $800 to $900 value that we're doing for $349, and it's working. And we've had a lot of people that are like, "Oh my gosh, this is helping me." And a lot of the times we'll have people say, "Can I try it once?" We're like, "Well, why not? Let's see. If you don't get any results, we don't want you coming back." But I haven't had one person that's come back and said, "Didn't work for me." Most everybody's had some positive influence, and sometimes here's the hard thing. Sometimes these things have happened over so many years. You take old men like me, and our eyes have been in such a bad state for such a long time. It takes a couple of procedures to get it done. But we do want results. That's what we're looking for.
Yeah. And that special for the buy one eye, get one eye free.
Oh, I forgot all about that. Oh my gosh. Okay. So there's the best thing. Because you guys have joined in on this, we've got a special promotion going on right now. This is just for you. Okay. It is $349 for a treatment. And we will allow you to participate. $59 gets you in your first treatment. Are you ready? You thought I just froze for a second. It's half price, okay? We're going to do, and we say buy one eye, get the other eye free, but it will be half of the $349. So it'll be like, I don't know, figure it up, 170, whatever. 174 and 59. So that's what the first treatment would actually cost. Let me tell you about that, though. We do need to evaluate you to know what we need to do. So we do need to we need to have one of the doctors take a look at you and say, here's what's going on. Here's what your problem is. Here's how we need to fix it. And so there are a lot of things that we can do with those fixings. We can do a cleaning. We can do IPL, low level light. We can do expressions. I mean, the doctors they've got a lot of tools in their bag to be able to use on this to fix things.
Yep.
Hit that next question.
Next question. I've had LASIK surgery many years ago. Am I a candidate? Absolutely. I have seen tons of post LASIK, PRK, RK, even CK people recently.
Yeah.
Surgery done a while ago, didn't last that long. But yes, post-refractive surgery patients are excellent candidates for this, assuming we go through the screening criteria, because there are some things like, for example, when it comes to IPL, like tattooed, one, I'm not going to get into too many details, but one thing is like tattooed eyeliner, for example. Okay. IPL can and technically has the possibility of depigmenting some of that tattooed eyeliner just because it puts out a lot of energy. Not that it's going to, but the possibility does exist there. That's just one example. But for post-refractive surgery patients, they have been responding phenomenally to this, because after the surgery, you've had your corneal nerves, the edges of them are cut off, and you're not making as much watery tear film as you used to. So we're going to get that oily layer tear film back, which is what all this stuff that we're doing is about.
That's right. And a couple things on the LASIK. A lot of the times, people that have had some sort of refractive surgery, their eyes, because of the surgery and the cutting, those nerves have been severed. So a lot of times, people don't even know how bad their dry eyes are that have had some sort of refractive surgery. Mm-hmm. And when you do an evaluation on them, you're like, oh my gosh, here's your numbers, and this is what it looks like. They're like, that's why they feel the way they feel. And it's like, yeah, that could be one of the side effects of it. Mm-hmm. Next question, how often do you need to have the procedure done? We leave that up to the patients. This isn't one of those things that we're going to say, well, you got to come in every 2 weeks for the rest of your life. That's not what we're doing. The procedure, the minimum that we can do for some of the procedures is 2 weeks. So if you had it done 2 weeks, you could have it done again in 2 weeks. Most of the time, and this is a generalization, but most of the time, we want this cleaned up in 2 to 4 procedures. Mm-hmm. We don't want to drag this thing on to 6 or 8 or 10 or 12. We've got too many dry eye patients to see, and we want results. Mm-hmm. And so there's a lot of different things that we can do with that. But it's something that, the procedure is something the doctors do need to evaluate, because we want to make sure that we're doing the right thing.
Mm-hmm. And can you do this procedure with chronic kidney disease? Yeah. As far as I'm aware of, with IPL, RF, low-level light therapy, there are no contraindications for chronic kidney disease. There are some things like, for example, let's say you've had recent skin cancer of your face, like in the past 6 months or something like that. Okay, we're probably not going to shove a lot more sunlight. It's basically sunlight energy. Probably don't want to exaggerate anything that's kind of been freshly removed. But let's say if it's been like years stable, anything like that, it's been proven to be extremely safe for things like that. But chronic kidney disease does not pose an issue for this, as far as I'm aware of.
Right on. Next question says, how do I pay for this? We do different things. We do all the credit cards and things like that, but we also do, you can use like your HSA and your FSA. Those are eligible things that we do through the clinic.
Care credit too.
Care credit. So I don't know if you know about care credit or not. Care credit is really weird. We have dogs in the clinic. We have golden retrievers, okay? And they come in and they're greeters and they love on everybody. But we go to the vet and we take them in and get things done with them. And the dogs, we were in there one time and they said, do you want to put it on a care credit card? And I'm like, oh, no. I've got enough credit cards. I don't need another credit card. Yeah. And they're like, well, you could pay your bill over 6 months with no interest. And I'm like, okay. And I got to reading on it and it said, I care. And I'm like, what? I care. We can do this. So the vet got us into taking care credit through the clinic. So this would be something that you can do to pay for it. Now, you don't want to let it go past 6 months because the interest rates, it is what it is. But if you like spread it out over 5 months, you're solid. Mm-hmm. And that's a good way to pay for it.
Another question, could this help dry eyes caused by Accutane treatment? It helped my acne years ago, but my eyes and nose have been dry for several years now. There's been several folks who have had some level of acne medication, whether it was Doxy, Accutane, or whatever it was. And there's been a lot of patients I've been seeing recently that have had some level of previous acne treatment, and then we've been doing this stuff on them, and we're starting to see some promising benefits from it.
Yeah. It really the low level light therapy. It's got multi functions to it, And it really targets inflammation, but it also targets bacteria. So sometimes when people come in, and we call it, there's hordeolums and other things, but what's called a sty. Somebody will come in with a sty on their eye. And Dr. Heffington has been treating people for this just with a low-level light therapy, not having to put them on.
No eye drops or antibiotics,
Yeah,
pills.
A lot of the times those antibiotics, you take those and they have to go in through your mouth, through your stomach, and it tears your gut up. And so by doing a topical treatment with light, it actually is more effective and gets faster results than letting the antibiotic take 30 days to get through your system to get to your eyes.
And next question is, how does this affect cataracts? It does not affect cataract progression or anything to our knowledge at this time. It doesn't reverse it. It doesn't progress it. It doesn't really do anything to the cataracts. This is just light-based energy going after skin tissues. This light energy is sensitive to certain layers and levels of the skin. Sometimes, depending on how the instrument is set up for whatever you're doing it for, it can, and your skin type, because we grade your skin type throughout this whole thing. It goes down to different layers of the skin depending on how much pigmentation you have. It's like a 1 through 6 skin grading type. You're basically graded somewhere between Nicole Kidman and Whoopi Goldberg, and you're going to wind up somewhere in the middle of all that, basically.
That's right.
And we just tell the machines, once we've graded you, what those energy numbers are going to look like.
Next question. How often do you need to get the treatments for upkeep after you're fixed? And that's one of those things, again, we leave that up to you. Some people it'll be never. Some people will be like, hey, you know what? I feel great for the rest of my days and it's going to be good. I'm going to say the majority of people, maybe yearly, because they want to feel that, they want that feeling again. And one of the procedures is Blefex that the doctors do. That's the cleaning of the eyelids. Okay, so this gets gross, okay? On your eyelids, there is a ring around your bathtub, okay? It's called biofilm, and it's on everybody. When we get soap in our eyes, it burns. We never clean our eyelids. And so eyelids are one of those things that you blink and then you blink and you blink. And if you can get those clean, it's like a new windshield wiper on the car. And so that's one of the things that we would like to do yearly is it's almost, I wouldn't put it in the same category as getting your teeth cleaned, but it's like right there. And when you have it done, most people are like, I want that feeling all the time. And you don't realize how bad you feel until your eyes feel good. And once they feel good, it's like, whoa, this is great. And then time trickles away. So maybe yearly, maybe not.
Yeah. How soon can you swim after having this procedure? Immediately, if you want.
Yeah.
The only thing some people notice is if you have really sun-sensitive skin, you might want to put some SPF 30 or greater on, basically. Just because with all the light energy, if you get a bad sunburn after it, it can make your skin hurt pretty good and maybe not feel that great.
The follow-up question that was, what can I not do after this procedure? Am I going to be able to drive? Am I going to be able to go back to work? Whatever's going to happen. You will go out the same way you came in, and maybe 45 minutes is the total time that we'll have you in the clinic doing what we need to do. So you'll be able to drive, you'll be able to do just everything like normal. Go back to work, go do whatever you were doing before you came in. So there's no downtime on it.
No.
It says, is it covered by insurances, Doc?
The procedures themselves, the insurance is a little bit slow to understand things a lot of times. So at this moment in time, it's not currently covered by insurances, vision, medical, anything like that. The time spent with the doctor as far as examination services, that can be billable under third parties depending on the circumstance and situation. But the procedures, the instruments and devices themselves, the insurance is still trying to understand how it all works. Because right now they're saying, oh, just give them an eye drop. They're fine with that. But we're finding and proving, evidentially speaking, that it's helping so many people, and us included in our staff and everybody there too.
I'll give you a little personal story on this. How many treatments does someone need? Again, we want to do one. That's why we're doing the half price thing for you. Try it out. You'll love it. And it will make a difference. And you will see results with it. But how many times total? I don't think we've done anybody more than 4. And probably the average is 2 to 4. If we don't get it by the 4th time, we need to be doing some other things to figure out what's going on.
And this is just a reminder that after tonight's event, you will receive a text message and reply with the word vision to be contacted for a consultation.
All right. Anything else, Doc? We need any other questions?
Nope. This is, let's see. If my eyes are red throughout the day, what are the eye drops that can be used? Okay, this opens up like an entire can of worms for what can be used for any redness or drops or anything like that. I mean, there's lubricant drops, there's allergy drops, there's even prescription steroid eye drops you'll need to get from your optometrist. I mean, there's a whole bunch of different things that from red irritated eyes can be caused from, basically.
Yeah, let's talk about that for just a second. So the red part of the eyes, there's things that are advertised, and you guys know what this is gets the red out, gets the red out, gets the red out. Well, that's a constrictor. Okay, it's a constrictor of the arteries to get the red out, which isn't the greatest thing to do because you need things flowing through it. And once it wears off, it comes back with even more of a vengeance.
Yeah.
So you can wind up in this bad spiral by putting drops in your eyes to get the red out. We would rather work on it on other ways to get the red and the inflammation reduced.
Yeah.
Once you can get it reduced, then you don't feel like that you have to go. But the redness may be just one of those things for a little bit until we can get the tear production and the oil glands functioning. The redness may kind of be there a little bit because if you just get it out, it's out. It doesn't last. It wouldn't be great if you just put the drop in it and it lasted forever, but that's not, they don't sell many drops if that's the case, right?
Yeah.
So they sell drops because it works for a little bit and you need more drops.
Yeah. You want to take this one, Mark?
Let's see what we got here. Is the $349 price for one eye or does that cover both? That is for just half an eye. Okay, $349. I'm just kidding. $349 is for a treatment. Okay, that is for whatever you need when we bring you in, and it will allow the doctors to do multiple things for $349. And again, with this special promotion that we've got going on, the first one's half price.
Yeah.
And so it will take it down to the $174 plus $59.
Mm-hmm.
And then your second visit would be $349.
Yeah.
And that is both eyes.
Both eyes.
I was just teasing. It's like,
Yeah.
yeah. We're kind of tired. We worked. Today was one of those days. It's like, and we're just, I don't know. I'm a little slap happy right now.
Yeah. It keeps it fun and interesting, though. So this one is, I've done that melt your eyelids expression procedure. That's the iLux squared that we still use on several folks that may not be candidates for this procedure. Would the $349 replace the need for that procedure, or would those be extra services that need to be added on for some patients pending consultation? Great question.
This is a long. Okay, get ready.
That's a great question.
Yeah, don't go anywhere.
Yeah.
He's got this. Catch this one. Okay, go.
So, for the different tools and things we've used over the years, think of it like different golf clubs in our golf club bag. You've got putters, you got irons, you got woods, you got all kinds of different things that we can use to help take care of dryness of the eyes, depending on what the condition is. There's Bruder Eye Mask, there's the Blefx, there's the iLux Square. These are things that we've come from previously for years of managing dryness. Now we're stepping into this new stuff that is awesome. It's amazing. The key is inflammation removal, which changes the game for everything for dryness management, basically. But all of this can be used in conjunction with one another. Now, you probably don't want to do this all at the same time. You probably want to talk with your doctor and make sure that you get the right stuff that you need. Because let's say that you have hormone replacement therapy, you have tattooed eyeliner, you've had a recent skin cancer of your face, or different things that you might not be a candidate yet for these new procedures and devices, but you might be a candidate for other stuff that we're having offered, because that would help at least open up and express and heat things open. And the tattooed eyeliner patients can actually sit under the low-level light therapy device. That one they're a candidate for, just not the IPL, because we don't want to take, unless you just want to take the chance and depigment that whole area and just remove it. But a lot of folks have spent a lot of money on that, and they may not be willing to part ways with that yet.
That's true.
Yeah.
Next question says, I have lupus. I'm allergic to the sun. Will I be able to have this treatment? Okay. So again, there's a lot of pieces to this. One of them is the light therapy, which we would really need to kind of flush out and talk about lupus and your allergies and what's going on with that. But let's go worst case scenario. Let's say, the light procedure is out for you. There's other procedures we do. We do a Blefx and we do an iLux, and those two things work incredibly well. So it's not just the light therapy that does this. This is the newest technology, the light therapy is. But that iLux, it's a rock star.
Yeah,
and it warms the glands up and expresses out the old junk, and it does a phenomenal job.
Mm-hmm.
Some people are very sensitive around their eyelids. Mm-hmm. And, it's one of those things that one thing does not work for everybody, but we got a lot of different things that we can do to help out. So the sun thing, we can talk about that.
Certainly.
Yeah. Let's see, one more question I've got that's popped up here. It says, how long ago did this come out, and why am I just now hearing about it? Well, I don't know. Here's how long ago it came out. 30 years ago. Okay, so this came out 30 years ago from dermatology. Dr. Heffington talked about that.
In the 90s.
Yeah, and so about 7 years ago, the dermatologists kind of punted to the eye doctors because the wetness is going on. They don't really understand things, what's happening. Eye doctors started picking up on it. We've stayed out of it. One, because it hurt. Okay, and the other thing was we wanted to make sure that we're doing the right thing for the right reason and getting the right results.
Yeah.
And until this last one came out, which I call IPL4, it is IPL with radio frequency. And it doesn't have this bite and the sting that IPL does. And the radio frequency actually drives it deeper to get rid of the inflammation.
Mm-hmm.
So as far as hearing about it, that's why we're here. We want to tell everyone about it. We're trying to help and educate, and we would love to do a consultation for you.
Yeah, absolutely. I think we're caught up on questions, unless anyone else has any. These have been good questions.
Great
tonight.
questions.
Yeah.
You guys have asked some
These
really
are
good
awesome.
questions. You know, these are things that a lot of people want to know. So we really appreciate you chiming in and saying, hey, I'd like to know this or I'd like to know that. We would love to help you. And I've had multiple sessions done, and I was one of the worst dry eye people out there. And I tell you, my eyes feel warm and moist. And I didn't realize how bad they felt until they started feeling good.
Yeah.
And then it's like, this is great. So I don't know. I've had 3 sessions. I may not have another one. I'm pretty good. We'll see. I may just be on yearly maintenance at this point.
Yeah. That's kind of where I'm at too.
Yeah.
Towards the end of my undergraduate, when my eyes started drying up because of all the computers and essay writing and all the stuff there, then obviously you throw optometry school into it, a lot more writing and computers and everything. And I tried everything from eye drops, heated eye shield. And yes, our school had a dry eye management clinic that basically had the latest and greatest technologies at the time there, which were helpful, but it's nowhere near this stuff now. It just goes to show how much like time, knowledge, education, technology changes. Because I'll be honest, this stuff when I was in school, it was talked about, wasn't really hammered home on in a lot of ways. So we've done a lot of homework and research the past couple of years to make sure this was the right time to go into this and pull the trigger on actually help. Yeah,
we're talking about
shooting.
We're from the Ozarks, right? All we do is talk about shooting and pulling the triggers. I don't know. Bunch of hillbillies, right?
Yeah. So,
that's our vernacular. That's not. But we did make the decision. You know, we made the decision. We like this can help. So that's what we wanted to do. Yeah. Close this up, Doc.
All right. Well, we want to thank y'all for joining us for this event tonight. These have been awesome questions. And if you have any other further questions or concerns or just kind of want to touch base with us, ask us some more questions about what we're seeing, what we're learning with this. And if you're a candidate for it, just give us a call at our main office phone during office hours, and we'll get you connected and evaluated by one of our doctors to make sure that you're an excellent candidate for this procedure. But for now, I'll go and close out with prayer, and then
that'd be great.
We'll kind of wrap up this evening from there.
Sweet.
Heavenly Father, thank you for this time. Thank you for the season. Thank you just for these awesome questions that we were able to help facilitate and answer, and hopefully get somewhere of letting your wisdom be made known. Help us just to continue to use the tools and instruments you've given us to help take care of people and to take care of our team as well too. We love you and just thank you for this time, this season, this opportunity to grow and learn and go deeper with you. In your name we pray. Amen.
Amen. So is there anything they need to do to click on or check on, or we send stuff to them? Or?
No, I think they're going to get a text message.
You're going to get a text
Then
message.
you just reply with the word vision to be contacted for a consultation, which could lead to an examination, could just be a discussion. It's kind of case-by-case stuff we're doing with everybody.
And you can call our offices too.
Yeah.
You know our numbers. We're local here, so we can help you and answer things. And we're here to help. That's what we want to do.
Yep.
We want to help people with but one last thing. Okay, so we always got one last thing. I'll have people come in with tears running down their cheeks, and they're like, "Why are my eye?" And I'm like, "Well, you got some sort of dry eye." And they're like, "No, I don't. I don't have dry eyes because I got tears running down my cheeks." And it is the oils that's missing, and they're producing so many tears to try and keep their eyes moist, and they got tears running down their cheeks because they're missing that oil because their glands are clogged up. That's what we want to help with.
Yeah.
We're confused. We think a lot of the times, like, we'll get on Google, we'll search things out. And it's like, I don't know how, and this is me personally, I always make the wrong assumption over what's wrong with me. I look at it and I'm like, okay, well, this is, I got this and this. And then I go see my doctor and he goes, oh, that's totally wrong. You've got this. And I'm like, I know what I'm talking about. Dr. Google told me this. He's like, yeah, you need to not even do that and just come see me. And that's what we want to do. We want to help people. So we can evaluate you that way. That's great.
All right.
Very good.
Well, thank y'all for attending.
Thanks for joining in. Yep. We'd love to see y'all soon.
Yep.